One of the things that people rarely talk about after an adult diagnosis of neurodivergence is the grief. Today I'm making this video to make people talk more about it, to help people to open the space, to make it a safe place to talk about this subject, because it's really important. It's a huge part of an adult diagnosis. Sometimes the diagnosis isn't the difficult part, it's the after part, the what next part. I often have clients coming to me saying, well, I'm diagnosed, but what happens next? With the grief, it's often after the diagnosis when you start to look back at things. Does this sound familiar? I'm Kat Sker, a counsellor and psychotherapist here in the UK, specialising in neurodivergence, trauma and sleep. A lot of conversations around adult diagnosis focus on more of the understanding. But today I want to talk about something I often hear in therapy which is much less discussed. It's grief. The grief that follows after an adult diagnosis of neurodivergence. Relief and grief can exist together. You may find yourself finally having the answers, almost like finding that missing jigsaw puzzle piece that's been missing your whole entire life until you got the diagnosis. Finally it fits. Finally you begin to understand yourself. But realising that there was a reason all along makes it even harder to understand some of the past. You may feel finally seen, but you may be grieving along with the relief. Does this sound familiar to you? For many after an adult diagnosis, they begin to look back at their life, maybe starting with childhood. What would school have looked like? Bearing in mind the schooling systems have changed drastically over the years with the support around neurodivergence. So perhaps you're looking back thinking, I was labelled as a naughty child, the bad one. I carried that whole label entirely through my schooling experience, and I never got the support that I needed or should have had. You may be looking back at friendships, wondering would those friendships have survived if I'd have known, if they'd have understood me? Would I have had as many toxic friends in my life, perhaps, as I have done because I didn't know? Have I always tried so hard to fit in that I've had the wrong people entirely around me my whole life? Looking back at relationships, for many this is a tricky one because you may have experienced a number of problematic relationships. You may begin to wonder, would that relationship have survived if I'd have known? Would I have been in that relationship if I'd have known? Looking back at employment, you may be questioning and wondering, would I have gone in that job? Would I have left that job? Would I have had a different career because of the problems that I've had struggling in the workplace? There's a number of questions that I often hear in therapy from others after an adult diagnosis. What would my life have looked like if I'd have known? Would I have understood myself differently? Would other people have understood me differently? What opportunities did I miss? Does this sound familiar to you? Then you may begin to think about the support that's been missing your whole entire life. For instance, school. School is a really tricky stage because it's a stage where labels and name calling and bullying and all the negative problems in a person's life may have begun. These problems never go away. They may have happened years ago, but they never leave you. Would I have received better emotional support from partners, maybe friends? How would educational support have looked differently? You may even look back at school reports and realise those reports were screaming out neurodivergence, not a problem child that wouldn't do their work or couldn't do their work, but somebody that was really struggling in the educational system, that in today's world, this wouldn't have happened. There may have been no accommodations whatsoever for you. There would have been a lack of support from the teaching staff, a lack of understanding from adults, from teachers. You may notice yourself wondering why people didn't notice, especially when you look back at those report cards and they're screaming it at you. Does this sound familiar? I also want to talk about the shame that comes with this, such as being called lazy, dramatic, maybe being called difficult. You may have been called rude, being labelled as not trying. It doesn't matter when these happened. These carry into adulthood and they stay with us. We may have internalized that shame and realized that those labels have actually never fitted. Does this sound familiar? When it comes to friendships and relationships, we may begin to question over those friendships that ended, those relationship difficulties. Feeling different and isolated, we may begin to look back over our lives wondering if these may have been different. Does this sound familiar? Then you may begin to look at the child you used to be. Maybe looking back at your younger self with kindness, rather than the harshness that you maybe applied your whole entire life. Seeing struggles differently and understanding behaviours differently. Recognising unmet needs and carrying sadness for what that young child had to carry. And then feeling compassion for your younger self, that what you had to go through, what you had to experience in a world where you shouldn't have had to experience those. Does this sound familiar? I also want to talk about the anger that nobody seems to talk about, but it's really important. This was part of an adult diagnosis. Anger at the systems, anger at the missed opportunities, anger at being blamed and misunderstood, anger at years of self-doubt, and understanding that anger can be part of that grief. Does this sound familiar? With an adult diagnosis, you can begin to build a new understanding of yourself. But grief doesn't cancel out the relief, and relief doesn't cancel out the grief. Both can exist together, and understanding your story can be painful. But understanding your story can be healing. Adult diagnosis can bring relief, understanding, and validation. It can also bring grief for missed support, missed understanding, lost opportunities and years spent wondering why things felt harder. If you've recognised yourself in any of this today, you're not alone, and both experiences can exist together. Thank you for watching. You're welcome to subscribe if you'd like further information around neurodivergence, trauma, and sleep.